Good afternoon. I'm Adrian Dix, BC Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing for BC for Monday, June the 29th. Tomorrow at 3 o'clock we'll be releasing a written statement with case counts. July 1st there'll be no statement. July 2nd, Dr. Henry and I will be in Vancouver to give a briefing, and on Friday there'll be a statement. We will be here tomorrow at noon to discuss some issues around visiting in long-term care. So we'll be having a discussion and a briefing at that time. I'm honored to be here on the territories of the Lekwungen-speaking people of the Songhees and the Esquimalt First Nations, and it's my honor to introduce Dr. Bonnie Henry.
Thank you very much and good afternoon. So today we are reporting on 3 reporting periods since Friday. And between Friday and Saturday, we had 10 new people test positive for COVID-19 in British Columbia. From Saturday to Sunday, an additional 14 people tested positive. And then over the past day, we had an additional 2 people test positive, giving us 26 new test positive cases since Friday, bringing our total in British Columbia to 2,904 people with COVID-19. That includes 979 people in the Vancouver Coastal Health Region, 1,529 in the Fraser Health Region, 131 people in Vancouver Island Health Region, 200 people in Interior Health, and 65 people in Northern Health. We have no new health care related outbreaks, leaving us 6 active outbreaks now, 5 in long-term care and 1 in acute care. We have had additional residents test positive for COVID-19 over the past 3 days, bringing our total to 386 residents of long-term care and 229 staff people who have tested positive. We have had 1 new exposure event, which was released on the weekend at Brandy's Exotic Show Lounge in the Vancouver Coastal Health Region. Public health teams are actively contact tracing, and several close contacts are in isolation. There were 3 individuals who tested positive related to that exposure event, and because we have not been able to directly contact all of the people who might have been at Brandy's, public notification was put out on the weekend. So anybody who was at the premises the late night on June 21st, 22nd, 23rd, and 24th between 9 p.m. and 3 a.m. may have been exposed and are asked to monitor themselves closely for symptoms. We are at a point now where people are in the incubation period, may start showing symptoms of this virus, and they need to contact 811 or call local public health immediately so that testing can be arranged. The other outbreak that we've had recently, one of the other ones, the Beresford Warming Centre, has now been declared over with no additional cases. And we continue to monitor and support at remaining community locations. So that leaves us with 153 active cases here in British Columbia, of whom 18 are now in hospital and 5 people in critical care or ICU. We have had no new deaths since Friday, and we now have 2,577 people who have fully recovered. As we move into this phase of our restart plan, we must remember that COVID-19 remains a risk for everyone. Even though our new cases are low, we need to keep it there. As we gradually transition, we need to remain vigilant. We need to remember that we need to minimize, we need to manage the number of the cases that we do have, and we need to modify our activities to make sure we're not putting our community at risk. A key part of our efforts to contain the spread is for all of us to support these contact tracing efforts, and by keeping our numbers of contacts, our bubbles, small, and by paying attention to where we go and who we are seeing. It is a team effort that we need to continue together in BC. In this most recent exposure event, public health teams issued a public alert because we were not able to reach all of those who were in the premises and may be at risk. One slip is all we need to cause a significant rebound, and we have seen that happen in jurisdictions around us. and that is something we have all been working hard to avoid. We have established clear rules for our safe social interactions that apply to everyone. These foundational rules allow us to increase our time with others, to restart many businesses, and most importantly, to stay safe while doing that. We have flattened our curve here in BC, and to be successful and weather this storm, everyone needs to continue to do their part, whether we're at home, at work, or traveling. And we want to be absolutely clear. We can't afford to have exceptions or half measures. Businesses need to be aware that you are responsible for keeping your employees and your patrons safe, and you could be liable if appropriate precautions are not taken to protect people when they're in your work. Visitors from other parts of Canada or even within the province, you need to stay home if you're not well, and don't come if you're not well. Those are things that are important for all of us so that we're not having events that expose people, particularly people who are more susceptible to severe illness or death from COVID-19. This is part of our respectful travel and part of our travel manners that we all need to follow, whether it's in BC or whether we're going elsewhere in Canada. Now is not the time to travel with any symptoms of COVID-19. So as Phase 3 allows for more types of activities, how we interact with each other doesn't change. No matter what your summer plans may entail and where you go, where you're from, be respectful of others by doing your part. We have to remember when this virus is anywhere, the risk is everywhere. The risk is to all of us. So let's continue to show that kindness and respect that have gotten us this far in this province, and remain 100% committed to our efforts to stop this virus here. And we also need to remember, of course, to continue to be kind and to be calm and to be safe. Thank you.
Thank you, Dr. Henry. I of course, we're always pleased when we can announce over the past 3 days that no one has passed away due to COVID-19 in BC. And we do reflect and remember those who have, however, and continue to keep their family members and the ones close to them in our hearts. As Dr. Henry has said, there are 18 people in acute care hospitals dealing with COVID-19 right now. That's 11 in Fraser Health and 7 in Vancouver Coastal Health, 5 in critical care. That's down, I believe, from 7 on Friday. Just a couple of small things in terms of healthcare system utilization. I've noted that in the past 3 weeks, we're back to normal in terms of the number of surgeries that are performed in BC in a week. It's been between 6,100 and 6,500 surgeries a week for the last 3 weeks, which is impressive. I'd also note that on June 26th, which was Friday, we had 5,869 emergency room visits in BC, and that 5,869 is the highest number since March the 9th. So clearly, our hospitals are again, they've been busy all along, but are again dealing with very significant number of cases in the emergency room and doing enormous and extraordinary work with respect to surgeries, and express appreciation to everyone who's doing that work. I wanted to bring everyone up to date on our PPE, as we do once a week. As with previous weeks, I'll report on how much PPE has arrived cumulatively since the end of March, and then specifically what has arrived over the last week. To recap the cumulative totals that go up to Tuesday the 22nd of June, the following PPE has arrived in BC in that time. Just over 5,719,000 N95 or equivalent respirators, almost 20 million surgical or procedure masks, just over 2,300,000 pieces of eye protections, including goggles and face shields, over 46,800,000 pairs of gloves, over 2,760,000 gowns. Many of the items I've just listed are in our testing process to make sure product meet or exceeds safety requirements before being used in BC's healthcare system. Today I can tell you that over the last week, since the last update on June the 22nd until yesterday, we've received the following in the last week, in addition to the numbers I just read. 214,920 N95 or equivalent respirators, 2,346,454 surgical or procedure masks, 1,864 pieces of eye protection, 2,834,300 pairs of gloves, and 65,035 gowns. We'll continue to source and test our PPE and are working hard to pursue any and all credible leads for safe and effective product for our healthcare system and for our workers. I wanted to join Dr. Henry in her comments of saying that this phase 3, the continuing importance of physical distancing is essential to our collective efforts. The continuing importance of staying home when you're sick are important to our collective efforts to flatten the curve and to stop the transmission of COVID-19. Our efforts have allowed us to proceed further with our economic renewal. Through our efforts, more businesses and industries are able to participate in our recovery. And with us now able to travel in BC to communities that welcome us, we've expanded our ability to play a greater role in the recovery too. In the days and weeks and months ahead, we need to remember this. While BC travel is a welcome break from the local places we know, it is not a holiday from the skills we've been taught to stop the spread. In fact, as we travel to new places and those we've not seen for a while, we need to be even more dedicated to the actions we've been taking to stop the spread of COVID-19. Wherever our COVID BC journeys take us this Canada Day week and over the summer, physical distancing must always be our closest companion. Physical distancing saves lives. I think this is important to remember, including in the discussion, whether you are traveling on an airplane from Toronto or anywhere else, that physical distancing remains essential and important to our efforts. And it'll be our expectation, as we are doing in BC and as we are doing in provincial jurisdiction, that the federal government will do the same in terms of ensuring that people are safe and are employing physical distancing as required, especially in places where they're together for a long time, such as airplanes. In this pandemic summer, we've got to continue to stay 100% all in, stopping the spread and helping others stop the spread while they explore our communities in our province. This will be the most important summer memory we can create. In our Canada Day celebrations and beyond, let us continue to stand together by staying apart. Let us continue to stand on guard against the spread of COVID-19. Quelques mots en français. Aujourd'hui, nous faisons le point sur le nombre de nouveaux cas pour 3 périodes de référence de 24 heures chacune, soit celle des 26 et 27 juin, celle de 27 juin et 28 juin, et celle de 28 juin jusqu'au 29 juin en mi-journée. Il n'y a eu aucun nouveau décès lié au COVID-19 durant ces 3 périodes de référence, pour un total de 174 décès en Colombie-Britannique. Nous continuons à offrir nos condoléances à tous ceux qui ont perdu leurs proches pendant cette pandémie. À ce jour, 2577 personnes dont le test de dépistage de COVID-19 était positif sont maintenant rétablies. Pour la première période de référence, qui s'étend jusqu'au 27 juin, nous avons eu 10 nouveaux cas. Pour la deuxième période de référence, qui s'étend jusqu'au 28 juin, nous avons eu 14 nouveaux cas. Au cours des dernières 24 heures, 2 nouveaux cas se sont ajoutés. Cela représente 26 nouveaux cas depuis notre dernière mise à jour vendredi, pour un total de 2904 cas en Colombie-Britannique. Et thank you very much, and we're happy to take your questions.